Choosing a place for spinal cord injury rehabilitation requires some thought. I think it's very important that it be a good fit, but it's also equally important that the center that you choose has specific expertise in spinal cord injury. You need that expertise to get the best functional goals, the best improvement after an injury to the spinal cord. Gaylord Hospital is part of the spinal cord injury model system. There are only 14 model spinal cord centers in the country. The model spinal cord injury centers are focused on quality care and research. It's a very competitive process. Gaylord is the only center in Connecticut that's part of a model system. Gaylord is also uniquely accredited by CARF for our spinal cord injury system of care. We're the only one in the state of Connecticut. CARF is an independent, not-for-profit organization that really focuses on quality of care and outcomes. That accreditation demonstrates our commitment to excellence, to our outcomes, and the results that we get for our patients.
Before a patient comes to Gaylord, our admissions department reviews the clinicals of patients in the acute care setting, and they get authorization from the payers. Then the patient's transferred to Gaylord.
When a patient gets admitted to Gaylord Hospital, they get assigned therapists, occupational therapist, physical therapist, speech therapist if that's appropriate, and a therapeutic recreation specialist. They complete an evaluation which allows us to establish what the person's abilities are in the area of mobility, self-care, and function. Once a person's evaluation is completed, we establish an individualized treatment plan, which can include a combination of individual and group sessions. Our sessions are run by a skilled clinician in the area of occupational and physical therapy, assistants, and rehabilitation aides who assist us in providing care for our patients by doing range of motion sessions, exercise sessions, and assisting in group sessions. Our therapy sessions may take place in our therapy gym, in the satellite gym, in the patient's room, or in any part of the hospital, including the outdoors. The patients are a big part of the goal-setting process. We provide education for patients and families with regard to what the treatments are going to include, what our long-term goals and short-term goals are, and what our expectations are at the time of discharge.
I help coordinate the care provided here at Gaylord with the doctors, the nurses, the therapists, and other specialists. The nurse care manager also acts as a liaison for the insurance companies, and I compile information and send it to them on a regular basis.
As a nurse manager, I'm responsible for the nursing staff as well as the certified nursing assistants, as well as a 37-bed unit. On the unit, we have several RNs and CNAs that run on each division. We have 24-hour coverage of CRN, which is Certified Registered Rehab Nurses. We have about 20 currently on staff today, and they oversee our RNs and nursing assistants and mobility techs. We do have ACLS or Advanced Cardiac Life Support nurses on staff 24 hours a day as well. The registered nurses work quite closely with the therapist. Each week we meet with the team leader of therapy services, and that represents the speech therapy, occupational therapy, and physical therapy. We also meet along with the care management and medical division, and we all discuss the patient's progress in each area and determine their length of stay and determine what their outcomes may be down the road regarding discharge.
Here at Gaylord Hospital, our spinal cord injury program really strives to incorporate the latest appropriate technology to help people that we serve. One example of that is the exoskeletal system. Exo is a robotic system that allows people that can't feel or move their legs to go from sit to stand to actually walk and get all the benefits of walking and weight bearing. We're the only center in Connecticut that has the Exo robotic walking system.
Our ADL suite includes a kitchen area where patients can actually practice doing meal preparation and other home management activities in preparation for their discharge home. Our bedroom has a ceiling lift with which we can practice our patients' transfers, do family training, and again, practice different types of activities such as making the bed, etc. We have a training bathroom where we have a large variety of bathroom equipment that the patients can try so we can assist them in deciding which equipment would be appropriate to be used in the home setting. In addition, we have a large number of power wheelchairs that have different types of access, including a head array system and sip and puff for our higher level spinal cord injuries so that they can improve their own mobility and determine what type of equipment they might like to use at home.
So this is Galia Hamcourt. She is our working facility dog here at Gaylord Hospital. She visits patients in the rehab division. She currently is able to co-treat with our therapist. We can throw the ball for her. We can have patients walking between cones for balance. She can also open up doors, turn light switches on and off, motivate patients to get out of bed. We've used her in a multitude of different things with the spinal cord stroke and brain injury unit. Recently, Galia had a patient that refused to get out of bed, so we used Galia to motivate her and get her shoes and socks to bring her to the bedside and encourage them to walk Galia to therapy, and it worked really great for that patient. We've also had other patients just request a visit for when they're down, just to take them out of the hospital for just a few minutes. Since Galia has been at Gaylord Hospital, she's been an asset to the rehab division, helping not only the patients, but I think the staff and visitors love her just as much.
Our spinal cord program includes community reintegration, which allows patients the opportunity to go outside into the community and practice the skills that they learned in their inpatient program. In addition, we run a spinal cord injury education series, which educates patients about different aspects of their care, and families are invited to this series as well.
I make myself available to provide support and answer any questions that the patient or family may have, and plan for the safest and most appropriate destination following their stay here. When a patient is ready to leave Gaylord, I work with them on making referrals. If the destination is to a skilled nursing facility, I provide a list and a packet of information that will help guide them through the process. If the patient is going home, I arrange for home care services and for any other specialty equipment that might be needed. The goal is to have our patients achieve the highest function during the transitions of care.
Gaylord's been providing care for over 100 years. I would recommend Gaylord for your rehab needs. If you're unable to visit Gaylord, please visit our website to view our outcomes and patient satisfaction.
We have a terrific team of rehabilitation professionals here at Gaylord working to help people with spinal cord injury. Highly trained, experienced, and compassionate individuals all working together to make a difference.
We are a family helping another family through their transition. With spinal cord injuries, my philosophy always was that it doesn't matter if you're wheeling or walking. It's about regaining your independence and being able to live the life that you wanted to live.